Hi, let's get ready for exam 3. We're going to review 5 terms from each of the chapters covered in this unit. Let's see how many of these terms you know. You might want to stop the recording and get out a piece of paper and pencil and write the terms out and quiz yourself a couple of times throughout the presentation. Hemiplegia, hemiparesis, dysphagia, ischemia, photophobia. Let's look at what each of these words means. Hemiparesis, hemiplegia. They both use the suffix hemi. Hemi means half. With hemiplegia, you've got ia is condition, state, or thing. Hemi is half. Plegia is paralysis. So starting with the suffix, the term means condition of half paralysis is the literal meaning. And hemiplegia is when a person has paralysis on one half of the body. That's left or right side of the body. Don't confuse this term with paraplegia, which means paralysis of the bottom part of the body. Paraplegia comes from a spinal cord injury. The paralysis is from the point of the injury downward. Now, paresis is a Greek word that means condition of weakness. Hemiparesis is when a person has paralysis on one half of the body, again, the left or the right side. Hemiplegia and hemiparesis come from neurological injuries such as stroke or head injury. Hemiplegia is more severe than hemiparesis. Dysphagia. Ia is condition, phase is speech, dys is abnormal or difficult. So let's start with the suffix condition, move to the prefix difficult, condition of abnormal, and phasio means speech, condition of abnormal, difficult, or painful speech. And the definition is actually difficult speech followed from a neurological injury. Do not confuse the word dysphagia with dysphagia, D-Y-S-P-H-A-G-I-A, which has to do with difficult eating or swallowing. So dysphagia is difficult speech. And you can pick up another term right here by changing the prefix to aphasia, which would be aphasia or absence of speech. Ischemia. Emia is condition of the blood. Isco is to block or keep back. So ischemia is a blocking of blood flow. If blood flow is blocked, it can cause death to cells that can lead to, if the ischemia is in the brain, it can lead to neurological damage. So a stroke comes from ischemia in the brain. It's often caused by arteries becoming blocked, so blood can't flow to the brain and you have a stroke, or it can come from a blood clot traveling through the body, traveling through the bloodstream, and eventually getting lodged in a smaller artery that again blocks blood flow to the brain. Related to ischemia is a transient ischemic attack, or TIA. Sometimes you hear of these as mini strokes. A transient ischemic attack is one where the arteries become blocked and the person experiences symptoms like a stroke, but the symptoms resolve within 24 hours. A TIA is a warning sign of an impending stroke. TIAs often happen at night when the person is less active and blood pressure is low. So if you've got a blockage of your arteries, then in the evening, when your blood pressure is lower, the blood can't be forced through these narrow openings. And that's when you get a blockage and the blood isn't flowing. You have symptoms like a stroke. You get up and you move around, your blood pressure increases, and then once again, the blood can get through. So it's pretty bad. The blood flow is blocked enough that when your blood pressure drops, that the blood cannot get through in time to seek medical attention. Photophobia. E is condition, photo is light, and phobe is avoidance or fear. So the literal definition of this term is fear of light, but it actually means abnormal sensitivity to bright light. It can be associated with inflammation of the eye, or it can be due to increased intracranial pressure or meningitis in the brain. So let's review. I'll say the word and then give you a chance to say it to yourself before I give the definition. Hemiplegia. It's paralysis of half of the body. Hemiparesis. It's a weakness of one half of the body. Dysphagia. Difficult speech. Ischemia. The condition of having blood flow blocked. Photophobia. It's the condition of having light sensitivity. Let's move on to the next chapter. The muscular chapter. How many of these words do you know? Torticollis, dystrophy, myopathy, polymyalgia, strain. Torticollis. Collis is a condition of the neck. Torto is twisted position. So a torticollis is an acute, often painful condition characterized by sustained contraction of the muscles of the neck. And they're usually one-sided, and they cause the head to tilt or turn sideways. So a tight muscle on one side of the neck, sometimes called a crick in the neck. Sometimes babies have this condition because of how they were positioned in utero. When I worked as an occupational therapist in a pediatric clinic with PTs and OTs, occasionally we'd see babies who come in for a torticollis because the muscles are tight. And the baby keeps their head turned one way because they don't know any different, and it hurts to turn the other way. So they get therapy to even out the muscles. Dystrophy. Trophy is the process of development. Dys is abnormal or difficult or painful. So dystrophy is abnormal development. The development of the muscles is diminished, and there's reasons why this can happen, such as disease, neurological problems, or even malnutrition. Now, on an exam, you would not be asked for what causes it, but sometimes I think it helps to know so that you can remember the term. Myopathy. A myopathy, pathy is disease, myo is muscle. So a myopathy is a category that includes different diseases of the muscles. If you have a myopathy, you have some type of muscular disease. Polymyalgia. E is condition, myo is muscle, algia is pain. So that's the definition of myalgia. So you kind of get two terms here too. So myalgia is muscle pain. Polymyalgia, poly means multiple or many, is pain in several muscle groups. Strain. When I think of a strain, I think of the STR in strain has to do with stretching, or has the three letters like stretching. So a strain is overstretching of a muscle, often due to physical exertion. And a strain happens in muscles or tendons, which are structures that move your bones. So strain, stretching of muscles and tendons, those are the things that move your bones. A tendon is what attaches the muscle to the bone. Not to be confused with sprain, which happens to a ligament. So a sprain, S-P-R-A-N, is also stretching, but it happens to a ligament, and those are what keeps your bones in place. So they bind the bones together. So let's review. Torticollis, that's going to be a spasm in the neck. Dystrophy, that's going to be diminished development. Myopathy, disease of the muscle. Polymyalgia, pain in multiple muscle groups. Strain, stretching of muscles or tendons. Okay, next chapter. Avascular chondromalacia patella, osteomyelitis, osteoporosis, arthroscopy. So avascular has to do with A is without, vascular is blood vessels, and R is pertaining to. So the definition, the literal would be without blood vessels, but it's an absence of blood supply. So if you have a bone that has an area that is avascular, it means that the blood supply has been cut off to that portion of the bone. And being avascular results in necrosis. Osis is condition, necro is death. So if you've got avascular necrosis, you've got a lack of blood supply that leads to death of a bone tissue. So you're going to have a portion of the bone that is diseased and will need to be addressed. Chondromalacia patella. Ia is condition, chondro is cartilage, mouths is softening. So chondromalacia is a softening of the cartilage, and patella is knee. So chondromalacia patella is when you have a softening of the cartilage around the knee. And it is associated with pain in the front of the knee from this soft cartilage. Osteoporosis. Poro is pore, os is openings, osteo is bones. So this is when you have small porous openings in the bone. And it's a condition that affects especially older women, and is characterized by a disease in bone mass with decreased density and enlargement of the spaces of the bone that makes them porous, brittle, and fragile. So it's the condition of porous bones. Osteomyelitis. Itis is infection or inflammation. Osteo is bone. Myelo is bone marrow. It's also spinal cord, but in this case it's bone marrow. So this is an infection, usually painful inflammatory disease of the bone or bone marrow. And it's often bacterial in origin. It can be very serious when you get a bacterial infection in the bone. You've got osteomyelitis, and that has to be addressed. And hopefully it's caught soon enough that antibiotics can do the trick. Arthroscopy. Scopy is the process of using an instrument to an exam, and arthro is joint. Not to be confused with arterio, but arthro, note the R, is when you have, in arthroscopy is when a surgeon uses an arthroscope to make a small incision. In the picture, it's showing a knee, which is a common place to have an arthroscopic surgery. And they're able to make a small slit, stick a scope in, and use cameras and complete a surgery being minimally invasive. So arthroscopy is a minimally invasive surgery. So let's try these. Avascular, without blood supply. Chondromalacia patella, softening of the cartilage around the knee, a painful condition. Osteomyelitis, infection of a bone. Osteoporosis, porous, brittle bones. Arthroscopy, minimally invasive procedure that uses an arthroscope. So let's move on to the eye chapter. Xerophthalmia, anoscoria, blepharoptosis, aphakia, diplopia. So xerophthalmia is, xero is dry, ophthalm is eye, and E is condition. So it's simply the condition of dry eyes. Anisocoria, E is condition, anis is unequal, and coro is pupil of the eye. So this is when you have unequal sizes of the pupils, left to right. When you compare them, they are unequal. Blepharoptosis. Ptosis is the state of drooping or falling. Blepharo is eyelid, and this is a drooping of the upper eyelid from excessive fat or sagging of the tissue due to age. It can also be from a disease that affects the muscles or the nerves. So a drooping eyelid is blepharoptosis. Aphakia. Ia is condition, A is away from or without, and phake is the lens of the eye. So this is a condition of being without a lens. Diplopia. Diplo is double, op is vision, and ia is condition. So it's the condition of double vision. So let's try. Xerophthalmia, dry eyes. Anisocoria, unequal pupils. Blepharoptosis, drooping eyelid. Aphakia, absence of a lens. Diplopia, double vision. So let's try our last set. Rhinorrhea, anosmia, presbycusis, autouria, algia. So rhinorrhea. Always think of rhino as nose, like a rhinoceros. Has a big horn where the nose would be. Rhino is nose, rhea is discharge or flow. Rhinorrhea is simply a runny nose. Anosmia. E is condition, an is not or without, and osme is sense of smell. So this is a condition of being without a sense of smell. And this can happen after a brain injury. It's actually a symptom of a brain injury. Presbycusis. Cusis is a condition of abnormal hearing. Presby is old. And so presbycusis is poor hearing due to old age. A similar term is presbyopia, which is when the lens loses flexibility and people have trouble seeing things up close. It typically occurs around age 40. So the literal definition would be old eyes, presbyopia, an extra term. Otalgia, E is condition, auto is ear, alg is pain. It's a condition of pain in the ear or an earache. Somehow, here we are. Autouria, it got in the wrong order. Rhea is discharge or flow, and oto is ear. Autouria is flow or discharge from the ear. So let's do a final review. And you can stop the screen here and quiz yourself, or you can listen and I will say the word, give you a second to say the word out loud to yourself, and then I'll say the definition. Hemiplegia, paralysis of one half of the body. Hemiparesis, weakness of one half of the body. Dysphagia, difficult speech. Ischemia, condition of blockage of the blood. Photophobia, light sensitivity. Avascular, absence of blood supply. Chondromalacia patella, softening of the cartilage around the knee, a painful condition. Osteomyelitis, infection of the bone. Osteoporosis, porous brittle bones. Arthroscopy, a minimally invasive surgery completed with an arthroscope. Torticollis, stiffness of the neck, one-sided stiffness of the neck. Dystrophy, diminished muscle development. Myopathy, disease of the muscle. Polymyalgia, pain in multiple muscle groups. Strain, stretching of a muscle or tendon. Rhinorrhea, a runny nose. Xerophthalmia, dry eyes. Anisocoria, unequal pupils. Blepharoptosis, drooping eyelid. Aphakia, absence of a lens. Diplopia, double vision. Anosmia, lack of smell. Lack of the ability to smell. Presbycusis, hearing loss due to old age. Otorrhea, flow from the ear. Otalgia, the condition of an ear pain or earache. Hopefully that puts you further along with your studies. Good luck on the exam.